So we are actually talking about upper GI bleeding. So discussion from upper GI bleeding led us to talk about what? The causes of upper GI bleeding. One of the causes where we said it was malarious tears, right? So in discussing about malarious tears, we also said that there's a concept known as what? Boerhaave syndrome. All right, and this Boerhaave syndrome is more of like Boerhaave syndrome is more of like a worst part or worst type of malarious syndrome. Malarious syndrome. So malarious syndrome is just a little tear, okay? It's just a little tear, all right? But in Boerhaave syndrome, it's more of like the whole thing is what? Like the tear, there's a complete thickening tear, like across the thickening length. The tear is just there like that, okay? And that's what we said is Boerhaave syndrome. That means through this mucosa, submucosa, and all those stuff, right? The tear was totally through this whole layer. All right. So we discuss this Boerhaave syndrome. We discuss it, talk about the causes, the symptoms, the diagnosis, and possible treatment for Boerhaave syndrome. Okay, as a cause of what? Upper GI bleeding. So the Boerhaave syndrome, like we said that it's a rare and life-threatening condition, which is characterized by a spontaneous rupture of the esophagus. Okay, so that means the full thickness of the esophagus is actually ruptured, and this is usually due to what? Forceful vomiting. Okay, epidemiology occurs in about 1 to 4 per 100,000 people per year. The age peak is for people that this thing mostly happens in people that are around 40 to 60 years, and it occurs more in males than in females. Okay, so what are the causes? Forceful vomiting has to be the top, which is the most common cause. It could be trauma due to falls or car accident. It could be some medical procedures like endoscopy, so mistakenly it went through your esophagus. It could be some esophageal diseases like cancer or strictures, right? So what are the symptoms? Patients who complain about chest pain, difficulty in swallowing, which is very, very key, all right? Because if you have that kind of wound in your stomach, it should be hard for you to swallow something, okay? So there will be vomiting, there will be hematemesis. What is hematemesis? Hematemesis is basically what? You vomiting blood, okay? There'll be respiratory distress, right? Then moving, how about the diagnosis? How can you be able to confirm that this kind of disease condition is there? Where you do check X-rays, esophagram, that's barium swallow, endoscopy, CT scan. All of this could help. Then what about the treatment? Surgical repair, fluid resuscitation. Why? Because the patient is bleeding. They have lost a lot of fluid, so you want to actually what? Replace those fluid and stabilize your patient, okay? You could use antibiotics just to prevent infections, pain management, nutritional support, okay? Complications. This could lead to what? Inflammation of the mediastinum. That's what? Mediastinitis. Could lead to pneumonia, could lead to abscess formation, lead to sepsis, and lead to what? Death. Okay, so that's it for Boerhaave syndrome.